Hey guys, what's going on? Welcome to another video on my channel, Hairliciously. If you guys are new, please make sure to subscribe so that you guys are updated on my second hair transplant journey progress, as well as video topics covering current hair loss treatments. Visit my website at hairliciously.com to purchase microneedling devices and dermal rollers, both of which are scientifically proven to stimulate hair growth, my low-level laser therapy cap, hair growth supplements, DHT vacuum shampoo and serum, and a few other products for those who are suffering from hair loss. So I know that it's been a while since my last update. The previous video that I did, which was uploaded about a week ago, was relating to me stopping Finasteride due to what I thought to be prostate related issues. Now, before I start this video, I want you guys to know that my prostate issue had nothing to do with me taking Finasteride. In my previous video, I told you guys that I stopped taking Finasteride for about 2 weeks because I was having some type of issues and symptoms that I thought to be related to the prostate. I stopped taking Finasteride temporarily because if my issue were really related to the prostate, I didn't want Finasteride to be lingering in the system, especially when I need to take a prostate-specific antigen, also known as PSA, which is basically a blood test that checks for levels of the protein in the prostate. Most medical doctors determine that a PSA level of under 4 nanograms per milliliter to be normal. What Finasteride is known to do is that it actually reduces the PSA levels to about 50%. So if you really had a high PSA level, let's say about 8, and you're taking Finasteride, theoretically it can actually come out to be 4, which would be inaccurate, and you can potentially get a misdiagnosis by your doctor or urologist. So that's the main reason why I stopped taking Finasteride temporarily for about 2 weeks. I think it was closer to like 16 or 17 days. So I did go see her. I did go in the office and I told the urologist my symptoms, which were basically tailbone pain, frequent urination, discomfort when sitting, kind of like in the groin area, and a few other issues. Now, I've never been to a urologist, so I really didn't know what to expect. And as I told her all of my symptoms, she said that it sounded like I had some type of pelvic floor dysfunction, which is obviously going to affect the ability to control the pelvic floor muscles. She then had me do a quick ultrasound of the bladder, which came out to be negative. There were no issues. And then she wanted to check my prostate. Now, at this point, I did read about the digital rectal examination and the horror stories, which involves a doctor sticking their finger up the rectum to check the prostate and look for any abnormalities. So she told me to bend over, and then she, so that she can actually feel the prostate, which is about the size of a walnut, and she was feeling it around. She told me that there was inflammation. She said that a regular normal prostate should be firm, but mine was kind of squishy, which was more indicative of inflammation. It obviously wasn't the greatest experience, but it wasn't too bad, although there were some pain when she was pressing on the prostate. I also did do a urinalysis, which came out negative. So she did diagnose me with non-bacterial prostatitis, which is actually the most common form of prostatitis that typically affects younger men. Some of the causes of non-bacterial prostatitis can be from, bicycling too much, if you're into cycling, which can put a lot of pressure on the prostate. Pelvic floor muscle problems, especially when you are usually constipated or straining during bowel movements, not being too active, which was probably one of the causes since the start of this, this pandemic, because I've been teleworking from home this whole time for the past few months. So the lack of exercise can definitely play a big part in me getting the prostatitis. Some other issues can be like nerve issues involving the lower urinary tract that can result in prostatitis. I don't think that's an issue with mine. And there's a bunch of other reasons why you can actually get non-bacterial prostatitis. Long story short, she did prescribe me 3 different types of medications. The first one, which is called diclofenac, which is an anti-inflammatory drug, which should help reduce the inflammation on the prostate. The second medication is tamsulosin, which is a alpha-1 blocker, and it works by relaxing the muscles in the prostate and the bladder for enlarged prostates. The interesting thing is that Finasteride was first used to treat enlarged prostates as well, using their 5 milligram oral tablets. But the difference between the two is that the drug that I'm taking, which is tamsulosin, is a alpha-1 blocker, while Finasteride inhibits the 5-alpha reductase enzyme, and that's why it's so effective when it comes to treating hair loss. The third medication is cyclobenzaprine, which is a muscle relaxant to help relax the pelvic floor muscles in the urinary systems and also the prostate. So I've been on these 3 medications for the past 8 to 9 days, and I can say that my symptoms have gotten better and also been reduced. I still haven't started taking Finasteride, and it's probably been closer to about 4 weeks, almost a month since I haven't taken Finasteride. I did ask the urologist about Finasteride, and she said that I can definitely take it in conjunction with the prostate medications that I'm taking right now. now, but I just decided not to and just to resume finasteride once I'm done with my medication. I do have a follow-up with the urologist later this week, and I'm going to ask her how much longer that I would have to take the prostate medication. And once I'm done with it, then I will go ahead and resume finasteride. It's more of a personal decision. Because the doctor did say that I can take finasteride for treating hair loss even when I'm taking these 3 different types of medications for my prostate. But, you know, personally to me, I just didn't like the idea of taking different types of drugs all at once. And I'm lucky enough to where stopping finasteride temporarily for a month or 2 isn't really going to drastically result in hair loss or hair thinning. So hopefully I can get back on finasteride sooner than later. At this point, I really haven't noticed any difference to the hair density, or there really hasn't been any hair loss so far, so that is a good sign. I will let you guys know once I'm back on finasteride, and also give you guys an update on how the follow-up goes with the urologist. I did have a few viewers from my last video who posted up some comments that were probably saying that I had prostatitis or some type of pelvic muscle dysfunction. So kudos to you guys for getting the diagnosis correct. Please go see a doctor or urologist if you guys are having similar symptoms that I was having. The prostate is such a delicate and vital organ, and you guys don't want to take any risks. Most of the younger men who do have prostate issues are typically going to be diagnosed with prostatitis, but please get it checked out, especially if you guys are older, 50 and up. Age and ethnicity also plays a big role when it comes to prostate cancer, and this is something that a lot of older men typically can get diagnosed with. So please get it checked out by a doctor if you guys are having any symptoms. And I know that the digital rectal examination isn't the most exciting thing, but in my experience, it wasn't too bad, and this could really be a lifesaver. And I'm also fortunate that it wasn't anything too serious, and thank you for all of those who are being supportive and leaving me comments. So there's the update on my prostate and my cessation of finasteride for almost a month now. I'll also need to do a 8-month update on my second hair transplant results. At this point, I just kind of lost track of my hair journey because I was just so content with how the second hair transplant came out. The hairline, as you guys can see, is just incredible. Just styling the hair is a lot easier. The density is amazing. It's super thick and natural looking. So hopefully tomorrow after this video, I'm going to be able to give you guys an update on my 8-month mark journey. There's also a bunch of other updates that I need to give you guys on some of the ongoing topics for treating hair loss, as well as videos on microneedling, stem cell research, more celebrity hair transplant results and transformations, and a bunch of other topics that I have in mind. I'm also going to upload my first car video for those who are car fanatics. My Lamborghini Huracan has been in the garage waiting just to be filmed. Anyway, I'm going to be back with more informative videos for you guys. But as always, thanks for watching, and thank you so much for all of your support. And hopefully I will talk to you guys soon. Take care.